So the level 7 came about from me studying these Health Education England recommendations for how injectables should be taught. And it was very clear that in order to proceed on to learning botulinum toxin and dermal fillers, you had to have a level 6 bachelor's degree, and then there were going to be these postgraduate qualifications that were developed. And the idea was that you could access those through universities or through Ofqual-regulated awarding bodies. And so in 2015, I got to work thinking about how to create the first Ofqual-regulated level 7 qualification in aesthetics. And I spent the following 18 months researching and writing this specification with one of the awarding bodies, alongside doing my own postgraduate diploma in aesthetic medicine at the same time. And that became the foundation of our level 7 qualification. So the qualification that we're offering at the moment at Harley Academy is a level 7 diploma, and the original version was actually a certificate with a different awarding body. And over the years we've learned how to create an overall better student experience, to optimize the assessments for our learners. And so we're really on our second major iteration of the level 7, and we think it's in a really great place, which is a balance of academic rigor and also accessibility and feasibility for trainees who are also in full-time NHS work typically. To run a level 7 qualification in a regulated, independent way, you have to be Ofqual-regulated. And what that means is Ofqual, the government's regulatory arm for education, oversees an awarding body, like an exam board, that ensures that each of the training centres, like us, are delivering qualifications to the exact specification. So it's not us that set the exams, it's not us that determine the exact specification, it actually gets externally moderated by our awarding body. So becoming Ofqual-regulated was essential, and that was the first milestone that we achieved in June 2016. Throughout the process, we've maintained very close conversations with the JCCP, and it was very important to me to make sure that everything we were doing, all of the studies that our trainees were doing, was future-proof. And that's why becoming JCCP approved means that we're absolutely mapped to the latest standards that are needed to meet these qualification requirements for aesthetic practice. So I think for graduates of our qualification, I'm very pleased to hear really good stories about how their qualification has enabled them to get jobs in clinics, to help them separate their brand from competitors, for example. I think that, as a prospective employer looking for an injector to join their clinic, someone who has a qualification in injectables immediately gives the assurance that someone has a standard of safety and understanding of aesthetics. They haven't just done a basic one-day course, for example, but also that they've done enough cases. So part of the criteria for our level 7 is you have to have seen at least 40 patients. And that is really a solid foundation to then build on. And you know that if you're employing someone with a level 7, they've got those fundamentals, they've had one-to-one training. And so I think having a level 7 sets you apart. I think it prepares you for future regulatory changes. And like I say, I hear really good stories from our graduates who have achieved a qualification and then gone on to have very successful careers. It's really important when trainees come onto our qualification that they know what they're getting in for. So the main reason a healthcare professional will choose to do a level 7 with us is actually for the intensive hands-on practical training that they achieve. And when they attend their clinics, for example, they really do get this one-to-one hands-on experience. But they have to be aware that there's also a significant theoretical and assessments aspect to that. And to be honest, we have such a wonderful student support team that makes sure that our trainees are catered to and supported throughout their journey. It's never a huge shock, but there is a literature review, there is a multiple choice question, and there is a logbook to fill up. And sometimes that takes a little longer than our trainees expect, but we always get there in the end. So when we asked our prospective students what they wanted most out of the course, it was always hands-on practical training. And there's no good giving all the theoretical academic aspects of a qualification unless they can also become proficient injectors, because that's really what they're here to learn. And so the only way for us to do our training was to deliver the highest quality hands-on injectables training. And the way we do that at Harley Academy is that it's always one-to-one. So you'll join us in clinic and it's your job to run the clinic. So we provide you with all the patients, all the products, the insurance, and you're there treating those patients and sometimes not treating them. It's a consultation which then leads to a treatment plan, which then leads to treatment. And of course, throughout the whole process, we provide you with one of our fantastic trainers, one of our clinical supervisors who are there to make sure that you're practicing safely and giving you tips on your injection technique. And that is at the very heart of the qualification. And there's no other way to do it to get the best outcomes for your training and for your career. Okay, so let's talk about career pathways. I typically say there are 3 ways in which injectors can get started. Number 1, they are completely self-employed. They decide to start a brand and perhaps they've got a bit of budget available to invest in a premises, take out a lease, start a clinic. And this is when you're going to be doing your own marketing and capturing your own patients. So number 1 is quite an ambitious first step. What you may prefer to do is options 2 or 3 initially. So option 2 is that you become a provider to an existing site. So for example, if there's a Medi-Spa or a place where there's lots of relevant patients that are coming routinely for other services, you could then offer injectables, you could offer other aesthetics services, and they do the promotion for you, and you end up with a weekly list of patients, for example, and then typically there would be a revenue share for the revenue that's generated in that appointment. And finally, option 3, which is probably a really desirable one for most injectors getting started, is to get employed. And if you get employed, then you're going to be working for one of the big clinic chains or perhaps a really prestigious independent clinic. And with that, you get all of the benefits of the ongoing training and the support, and it's much more like your usual NHS work. But these are really competitive posts. And so there have got to be ways in which you try and stand out. And the best way to think about it is, if you're an employer, what would you ask your prospective employees to have? Perhaps it's really good patient manner, perhaps it's lots and lots of experience, perhaps it's a level 7 qualification. And so if you can't get a clinic job straight from day one, don't let that put you off, because the market is growing and there are many, many jobs available for good injectors.